lifespan of, the mean lifespan of African Americans, men and women, is shorter than that of Caucasians. What do we do?
Well, I think that what I've been outlining here is a roadmap, which is I really do believe that, you know, many of us in this room have been looking at and looking at health inequities and how we look at individual either initiatives, research, et cetera, that will really move that agenda forward. But I think in order for us to truly address those inequities, we need a much broader approach. We all know that health is complicated. It's about healthcare, but it's also about public health. It's about that bridge. It's about our communities. It's about economic development. It's about education. And what I'm proposing here is that we use the health lens to really create an approach that really embraces all of the above. So that I can't tell you the very specific answer. What I do know is that we need to get much more aggressive about really developing approaches that embrace health in all of its complexity, because we know that improving the lifespan isn't going to be the outcome of one single randomized controlled trial in which you vary one particular variable. They're very important, but we need to really become much more comprehensive around this approach, similar to the Great Society, similar to the war on poverty. Susan Whitehead.
We all know that so many extraordinary young people are going into medicine, and I'm just personally struck by how many of those young people are going overseas. And I wonder if that's something that strikes you and whether you might have any advice for them.
That is a really, that is a fabulous question, because it's something that we think a lot about. And I think that, first of all, I find it very exciting that so many young people are passionate about improving health around the world. And that's an energy, first of all, that we need to harness. And the experience, if we think about the experiences that many of our young people have when they go to the developing world, they are much more likely to see this closer connection between healthcare delivery and public health, right? Think about that. Those are some of the lessons that they are learning. And I think it's critical that we make a very active outreach to young people to not only harness their energy when they come back, but to gather and harness their learning. Because I think there's a lot that we can learn from them to propel our own movement. They are really the people that we should look to at the front with the innovative ideas. And I know that they have them, but I think we need to make a much tighter connection. You know, we are interdependent, so the health around the globe is critically important to our own health and well-being as we move forward. Yes.
Hi, my name is Roy Wade. I'm a Commonwealth Fellow. Thank you, Dr. Johnson, for a very powerful speech. Earlier in your speech, you talked a lot about paralleling civil rights, the civil rights movement, with our current healthcare situation. And you talked a lot about states' rights sort of impeding that process. How do you think that we could work to address the problem of states' rights? Because many of the innovations that we might come up with to solve problems still might impede on the rights of others. And how do we sort of work to sort of, address those issues so that we can progress forward?
So I think that's a good question around the states' rights question. And the way that I framed that was to say that here we have a federal law, the Affordable Care Act, and we are now seeing challenges at the state level. And the kind of correlation is what makes us go the extra mile? What ends up happening that allows the federal voice, okay, to be heard, at least in this situation where I believe it's critically important as we move forward around not only health care, but a movement for health. And I liken that to the Johnson not being able to have the votes. And I think the big difference here is that there really isn't a loud voice. I would venture to say the list that I read off of what the Affordable Care Act can do for health care at least, and for some aspects of health in the United States, is hardly known by the vast majority of Americans. And if it was, and if it was known in all of its complexity, I think we would have a different viewpoint overall. Because when you ask people about individual pieces, they think, oh, this is a great idea. But there is no collective voice that's speaking out in favor of not only the act, but also propelling the movement even farther, which is how do we achieve health? And so I think the lesson here is that we need to develop a better communication strategy. What are the media strategies we need to be using? What are the communication strategies? How do we get people on board? And so I think those are some of the lessons that I'm taking away as to how do we move this forward. And in this particular case, really fight against what we're seeing as a state struggle to overcome the act. Michelle.
Dr. Johnson, thank you for your phenomenal lecture and your trailblazing for all of us. My question is, medical institutions, academic institutions are part of the healthcare system and presumably part of the healthcare solution. You mentioned the gold standard of randomized clinical trials, as part of the guidance for how we deliver healthcare. However, you also mentioned the importance, and your entire talk was centered around the importance of looking at laws and how laws might change processes. However, I think there's this disconnect in our academic medical centers about looking at the impact of laws on health and still, siding with the randomized clinical trial as the only standard that one uses to certify that something is good and is valuable. And that is of concern to me, and I wonder what your comments are related to strategies of how one might, sort of narrow that bridge.
Well, I think that the question is, what is the role of the academic medical center moving forward? We are very important organizations. We are rich with intellectual resources, and we are the home of not all, but many innovators. And what I would say is, over the next 10 years, part of our charge will be broadening the scope of our work, broadening the approach of our work, broadening that bridge, not only between public health and healthcare, but between health and policy, not just in the purely academic sense, but how do we understand the contextual sense of policy, communities, and actual delivery and health. And I think by really beginning to shape a broader vision for what the role of the academic medical center, in partnership with others, can be, I think it'll get us closer to addressing the issue that I think you're bringing up. Does that answer your question? Okay. We have one back here, and then I'll take you. Yes.
So during the lunch today, you mentioned, kind of as part of the research you had done to find models in Boston that demonstrated this intersection between public health and healthcare delivery, the participation of education and industry as well. And I was wondering if you could elaborate a little bit more on some of the favorable interactions with industry and how we can expand those and perpetuate them a little bit more.
So the example I was talking about today, and there are others in this room today, Ruth Ellen Fitch is here from the Dimmock Center. I mean, there are some amazing people in this room who really embody and exemplify a lot of what I was talking about in today's talk. But the work I was specifically talking about was work that we began a number of years ago, looking at the affordability and accessibility of healthy food in the city. And we started with a very small, but the question was, how can students get involved? And I was talking about the fact that we don't have to start always with the largest multi-center, multi-million-dollar study. We started with a very small study design of understanding what cultural food might be in 2 different communities, costing that out, and then really testing that against the standards for affordability. And in fact, what we found was that what we are recommending in our office, right, is really not affordable if you are living at the margin in terms of economics. But what was even more important was that work. It didn't stop there. That work then, we created a real focus around bringing together nonprofits, industry, the Public Health Commission, and other agencies to begin to address how might we think about this. That led to work at the city level, and then finally a food policy council, okay, that is really looking in a very much more structural way from a city, and now it's moving up to the state, but from a city level, from bringing in industry, as well as a number of other organizations on issues of healthy eating. And we are now starting, they'll be now starting another piece of that work that will be looking at supermarkets. And that'll be a partnership between healthcare, industry, city and state government, public health, kind of the real ideal. But the example was one that said the work doesn't have to be grand at the beginning. Small work can make very significant impact if you follow through. And I think that was really the piece, the point of that story.